Next test is called the active compression or O'Brien's test. This test was originally described for slap tears, and O'Brien actually described it it's almost like 100% sensitive and specific. So it seems to be a pretty good test. A lot of people like using it. Some subsequent studies haven't shown it to be quite 100% sensitive or specific, but it still seems to be a pretty good test in the hands of a lot of people that examine patients with shoulder labral tears. Now, the beauty of this test is that it tests several things. It tests for slap tears, but it also tests for AC joint problems. The way you're going to do this test is have your patient bring the arm to 90 degrees of abduction, and we have him internally rotate it and horizontally adduct across the body about 15 degrees or so. I'm going to have him hold it there, and I'm going to give some resistance, and I want to know if it hurts. Okay, put it down for just a second. It's going to hurt in one of two places. It's either going to hurt on top at the AC joint, or he's probably going to describe it, if it's a slap tear, deep in the shoulder, so not really palpable. Probably pretty palpable on the top if it's AC joint, but deep and not palpable if it's a slap tear. So the first part of that test, I do it and I ask, does it hurt or not? He says yes or no. If he says it hurts, I want to know which location it hurts at. Then I bring him back up to this position, and this time I have him supinate. So there's a second part of this test, supinate. I give resistance, and for this test to be positive, the pain has to at least decrease. It doesn't have to go away, but it's got to decrease a little bit from the internally rotated position to the externally rotated position. If it decreases, it's considered a positive test. If it increases, it's something totally different and probably not either negative or positive. We have to just look a little bit further.